My name is Dr. Geoffrey Mutuma. Today we want to talk about one of the common diseases which we have. And as we know, nowadays we are having mainly four types of diseases which are giving us a lot of problem as a population, giving us a problem as Kenyans. And the first one is cancer, which we have covered in most of the episodes which we have done before. We have got diabetes, which is quite common. We have the hypertension, we have kidney diseases, and we have got arthritis. And then we have got chronic obstructive airway diseases, that's asthma, emphysema, and the rest of the diseases which normally affect the respiratory system. So today we want to talk about diabetes, and I want to go into details a bit about diabetes because diabetes is quite common. And according to the investigation which we have done and the research we have done in our hospital, which is in South B, the best hospital, we have done a lot of health talks. We have done a lot of screening to populations, mainly in towns and in villages. And we have found that diabetes is very, very common. In fact, what we have found is that 15% of the population, the adult population, they have diabetes and they don't know. It means that in every 30 people, there are two people with diabetes and they don't know. And that's how common it is. And that's why you find that even at this time, normally in almost in every home, or yeah, and even some few homes, because every home there's somebody with diabetes, or in some homes, because people who have several people who have got diabetes. And one of the thing of the diabetes now, it is starting very early in life. Before we used to say that diabetes starts after 40. In fact, it used to be called adult onset diabetes. That's diabetes after 40 years. But now we have found that actually diabetes becoming very, very early in life. We have people who have 20 years got diabetes, or people who have over 30 years with diabetes. Even by 40, most of the people have got diabetes. And as we know, that actually diabetes tend to increase with the age. And what is diabetes? Diabetes is just sugar. It's just sugar in the blood. And that's why you find that people who have got diabetes is that they've got a lot of sugar in the blood. But that sugar is not useful to the body because the sugar is in the blood, is not in the cells. So mainly, when we say that somebody has got diabetes, it means that it has got a lot of sugar in the blood and there's no sugar in the cells. Now, what we know about sugar is that is the sugar, is the glucose, is what gives the cells the energy to work and to walk and to think. And that's that when somebody got diabetes and is not getting enough sugar in the cells, it's not getting enough sugar in the body, he has no energy, and he goes to coma, which is sometimes is not known why that happens. And most of the times, people go to coma with diabetes and actually they pass on without people knowing, because once you have a lot of sugar and the sugar is not going into the cells, you cannot walk. And the same reason, the same fact is that when you're not eating, you don't have any energy. You start feeling lethargic, you start feeling tired, you cannot do anything. It's the same effect. So normally in diabetes, we say that person starves in the midst of many. He has sugar, but he's starving. And that's why one of the first signs somebody has got diabetes is when somebody starts to reduce weight, because you reduce weight because you don't have sugar, which is in the cells. So when somebody has diabetes and he has reached that place of losing weight, uh, because one of the signs that somebody has diabetes is when he's losing weight. One of the reasons that there is something wrong with your diet is that you are losing weight. You are eating, but you're losing weight, and you have no explanation why you're losing weight. And that's why most of the people who have got diabetes, even that they lose weight, they keep on losing weight, they are eating, and they're not feeling getting anything, because one of the things, and I think I talked about the non-communicable diseases, that they're not painful. And we know that diabetes is not painful and somebody does not feel anything. And that's often that people who have got diabetes, they normally stay with their disease for a long time. And since it's not painful, somebody does not feel anything. And somebody can stay for diabetes for a long time without knowing. And that's why the only time we discover diabetes, we discover it by mistake sometimes. We normally discover when somebody got to be checked or somebody has got signs symptoms of diabetes. Now, so how do you know that you got diabetes? How do you suspect that you got diabetes? Diabetes has got three main signs. And first is passing urine so many times, mainly at night. But that when you start developing diabetes, you used to sleep until morning, and when you develop diabetes, you start waking up at night when pass urine. It's called polyuria, And then other thing, you start taking a lot of water. You are thirsty all the time because diabetes. So you got polyuria. And then the other thing is that you start eating a lot. You are angry when you feel eating. You have to eat. That's called polyphagia. So there's polyuria, passing out of urine. There's polydipsia, that's taking a lot of water. And there's polyphagia, that's eating and eating all the time. You feel that like eating all the time. And then other signs and symptoms I've said is loss of weight. And then, of course, when you've got diabetes, you don't feel anything apart from those two signs or three signs or four signs. And you can have only one. You can be passing urine but you're not taking water, or taking water but not passing urine. And that's why somebody with diabetes stays for that disease for a long time. The rest it is not painful, just high blood sugar, which is in the blood alone. Now, what we know about, of course, the best thing to say is that if you don't eat, you not have diabetes. So diabetes is brought by food. Kwa hivyo, so you find that actually when somebody has got diabetes, is that because of food, because of eating, and we're having diabetes today because we are taking a lot of sugar. We are taking the sugar itself, which is actually pure sugar in the tea mainly, and then we are taking food which is converted to sugar very fast. So you find that both the sugar which you are taking every day and also the food you are eating every day, that's being converted into sugar very fast. And that's why you find that any starch, mainly the food which is converted into starch which is starch is the one which is converted into sugar. And so with the bananas, with the ugali, with chapatis, with bread, with rice, all that food is converted to sugar. And that's why diabetes has become very common nowadays, because we are taking too much sugar in the tea. That's the first thing. Second thing, we are taking refined food, the food which is converted into sugar fast. And that's that because of we are eating refined food, refined maize, refined rice, refined wheat, refined all that starch which is refined. That's why I find that the blood sugar is becoming very high, because what is happening is that all these food are converted into sugar, and because we are eating too much of it, we have got too much sugar in our body. So the insulin which is supposed to lower the sugar, or it's supposed to push the sugar from the blood into the cells, is not sufficient. And that's what we call the adult onset diabetes, which is caused mainly by diet. So diet is our risk factor, is the only risk factor, in fact, about diabetes, because I find that because we're eating too much, or you are eating too much sugar, too much fine food, and then other factors, we increase weight, we don't do exercise, all that happens, or it predisposes somebody to develop diabetes. Okay, most people have got high blood sugar and they don't know. And the only thing I do is that be checked and know what is happening. And more important, which I talked again, make sure that at least use a supplement, because that's very important. You can always ring me, you can always call me in case you have diabetes, or you want to have reduced weight, or you want to see what you can do with other diseases, because I normally use supplements which I normally recommend to my patients. And my number for those who want to call me, my number is 0722 801 299. 0722 801 299, and the other number is 0734 801 299. 0734 801 299. Those are my numbers. You can always get me, and you can always follow us in the Facebook or in the YouTube. And then we normally have cancer walks, which are coming very soon. We normally have cancer walks in February, mainly, and cancer walks in October. In February we have done, and this October we'll do in Meru on 30th. We'll do in Makueni on Machakos, in Makueni County. We'll do it on 7th, and we'll do on 14th. We'll do in Kwale County. That's how we'll be able, because as my background as a pathology and a researcher, which I've done a lot of research in cancer, what is very important with cancer, apart from diabetes, is that you just have to know it early, and you just need to get treated, you just need to follow it. And the only thing you can do and save lives, one is create awareness of cancer, do screening. That's what saves life in cancer. Awareness, people to know that cancer is very common. What are these factors of cancers? Go for screening, and we'll be doing a lot of screening. We'll be doing screening in the hospital, here in Zambezi hospital. We do screening every day. If you want to screen for cancer, come at time. We'll be able to screen you for a few cancers, and even for the cancers, we'll be able to screen you. And screening is normally very cheap. And the other thing we need to do is actually to do treatment. we do diagnosis treatment, and we have assisted so many people in diagnosis of treatment. So you can always get in touch with us. We will be able to see what we can do. Not that we can do much, or not that we can be able to help a lot of people, but the few people we reach, the few people we come across, they benefit with us. So is my call that in case of any issues, I've given my number. You can always call me to ask a question or what you need to do in case of a patient or you have several issues of cancer. You can always get in touch and be able to assist you. And of course, if you want to come and ask us to come and do screening of your cancer at any place in Kenya, you'll be able to come. Nowhere cannot go, and normally the only measure is that you must meet more than 50 people, because we don't want to leave our hospital and go to screen people and find that the only people who can screen is 2 people who are there. They've done that before, or 5 people were there. That's not economically viable. But whenever there are 50 people, of course, you know that we'll be able to screen cancer and normally give a very good discounts. And like nowadays, 3,000, you can be able to screen most of cancers. You can screen a few cancers, you can charge you 2,000, depending on how we agree and where you are. That's mainly from Nairobi. So thank you very much for being with us, and always will be at your service. Whenever you need us, please get in touch and be able to see what we can do. Thank you very much.